We have Dr. Shawn Hirsch, senior psychologist with the Menninger Clinic, joining me live to talk about how this challenge can make a huge impact. Thank you for your time this morning.
Of course, thanks for having me.
Well, why are challenges like this so important for raising awareness of a cause, in this case now for mental health?
Well, we know that our young people are suffering from, mental illness and struggling with depression and anxiety far more than they have in previous generations. So it's very important that we get the message out that psychology and psychiatry don't have to be scary things. We all struggle with things, and sometimes we need help.
Yeah, and it can really, I think, break down stigmas, right, and start those conversations. I know my teenage daughter did the challenge a few days ago. How do you start a conversation with your friends or your family members to start sharing experiences?
Well, I think with our kids, when it comes to that, it's never too early to have conversations about our emotions. As parents, we want to protect our children from any kind of unpleasant experiences, and we often try to minimize our own struggles and pretend like we're kind of bulletproof or that we're not struggling as much as we are. But when we talk to our kids about our emotions and our feelings and our experiences regularly, it helps them understand that, mental health is a part of our life, and we all struggle with things, and we can all ask for help.
And I think that, telling them that you're not going to judge them is really the key, and that, you've experienced things like this too. Like you said, when you notice a change in behavior, how do you approach that with your child?
Well, I think that it's, being present is part of it. In order to, see what's going on, you have to kind of be present and aware of them. But I think, at this point, if you notice something, please ask your kid. You just say, hey, I've noticed that you might seem a little bit down, or you're a little bit, acting a little differently than normal. Can you tell me about it? What's happening? And just like you said, we have a tendency to try to fix things or provide an adult perspective. If we can use respectful curiosity and truly ask them about what they're experiencing and get them to explain it to us in their own terms, then they're going to be more likely to rely on us.
This challenge, from what I understand, as of this moment, has raised more than $300,000 to support mental health resources. How important is funding for this cause, and what still needs to be done to tackle the mental health crisis? And I know that's a big question, I know.
Well, funding definitely helps. I mean, Texas is pretty lowly ranked as far as access to mental health services, particularly when we get in rural areas. So the more that we can raise money and provide people with services that they may not be able to get through their own paying out of pocket is a good thing. But really, more importantly, these viral challenges really just spread the awareness and, like you said, reduce the stigma and gets everybody talking about mental health and hopefully seeking it in the same way that we would seek help for any kind of physical illness or malady that we need.
Very good. All right, Doctor, thank you so much for joining us this morning from the Menninger Clinic. Great perspective on this viral challenge that's come back once again. I think it's great that it does do this every few years, it seems like. Appreciate it.
Yeah. Thank you so much.
And if you do want to do a good ice bucket challenge this weekend, the temperatures are good enough